Hi, I'm Richard Woodhouse, and this is my TED Talk about achondrogenesis for my Semester 2 biology project. Achondrogenesis is kind of a long word, so I wrote the pronunciation underneath of it so you'll know how to pronounce it. So let's get started. Achondrogenesis overview. Achondrogenesis is a genetic disorder. It is a group of severe disorders that can affect the development of bone and cartilage. These effects are characterized by a small body, short limbs, and other skeletal abnormalities. Due to the severity of these conditions, infants with it usually die before birth, are stillborn, or die shortly after birth due to respiratory failure. From the National Library of Medicine, researchers have described at least 3 forms of achondrogenesis, designated as type 1A, type 1B, and type 2. These types are distinguished by their signs and symptoms, inheritance pattern, and genetic cause. Achondrogenesis type 1A and type 1B both are autosomal recessive, which means both copies of the TRPL11 or SLC26A2 gene in each cell have mutations. Most often, the parents of a child with an autosomal recessive condition each carry one copy of the mutated gene but do not show signs and symptoms of the conditions. Achondrogenesis type 2 is considered an autosomal dominant disorder because one copy of the altered gene in each cell is enough to cause the condition. Type 2 is almost always caused by new mutations in the CO1-2A1 gene and typically occurs in people with no history of the disorder in their family. All types of achondrogenesis are very severe skeletal dysplasias, usually detected by prenatal ultrasound examination as early as week 14 to 17 of gestational age. So, achondrogenesis type 1A. Achondrogenesis type 1A, also known as the Houston-Harris type, is the least understood out of the 3 types. Infants with this are characterized by dwarfism with severely short limbs, narrow chest, short ribs that fracture easily, and lack of normal bone formation in the skull, spine, and pelvis. Achondrogenesis type 1A is an autosomal recessive neonatal skeletal disorder. Mutations in the gene TRPL11 are identified as the suspected cause of type 1A achondrogenesis. The gene TRPL11's purpose is to provide instructions for making a protein known as GMAP210. The protein GMAP210 helps maintain the structure of Golgi apparatus. The Golgi apparatus you can think of as the cell's postal office. It helps process and package proteins and lipid molecules to be exported from the cell. If GMAP210 was absent, then the trafficking of protein to the endoplasmic reticulum is stopped. The endoplasmic reticulum can be considered as the cell's protein factory. The disturbance in protein trafficking results in a collection of protein gathering in the endoplasmic reticulum, causing cell death. So here's a picture of a healthy infant on the left, and then on the right is a picture of achondrogenesis type 1A infant. And both of these are x-rays. So you can just compare the skeletal abnormalities. Achondrogenesis type 1B. Achondrogenesis type 1B, aka the Parenti-Factoro type 1B, is characterized by a prominent rounded abdomen, short limbs, narrow chest, short fingers and toes, and club feet. Club feet is feet that may turn inward and upward. Infants with this commonly have a soft outpouching around their belly button or near the groin. Type 1B is considered to be the most severe skeletal disorder caused by mutation in the SLC26A2 gene. This gene provides instructions for making a protein that is needed for the proper development of cartilage and for its conversion to bone. Mutations in the SLC26A2 gene cause the skeletal problems associated with achondrogenesis. The mutation caused this by disrupting the structure of developing cartilage, which prevents bones from forming properly. So again, here's a picture of a healthy infant on the left, and then on the right, here's a picture of an infant with type 1B achondrogenesis, and then there you compare and see the very prominent rounded abdomen. Achondrogenesis 2. Achondrogenesis type 2, aka Lander-Saldino type 2's common effects are short arms, short legs, small chest, short ribs, lung issues, prominent forehead, small chin, and an enlarged abdomen. Achondrogenesis type 2's predicted cause is a mutation in the gene CO1-2A1 gene. Most often in cases of type 2, it is caused by new mutation, which means parents of affected child's next chance for another child to have the same condition is not higher than 1%. The gene CO1-2A1 encodes collagen type 2. Collagen is one of the most common proteins in the body and an important building block of connective tissue. Collagen type 2 is most frequent in cartilage and fluid that fills the center of the eye. Similar to other types of achondrogenesis, the problem occurs in the production of necessary items needed to make cartilage. Achondrogenesis type 2 is the most common type and it occurs approximately in 1 in every 40,000 to 60,000 infants. Achondrogenesis type 1A and 1B is so rare there's no set rate of occurrence. So then again on the left is a picture of a healthy infant, X-ray, and then on the right a infant with achondrogenesis type 2, and you can see the abnormalities, and then you can also compare and go back and see the abnormalities that differ between each type in the x-rays. So prognosis and treatment. As mentioned before, all types of achondrogenesis are usually detected by prenatal ultrasound examination as early as week 14 to 17 of gestational age. Unfortunately, there is no cure for achondrogenesis, and there is no life expectancy for anyone diagnosed with it. In other words, achondrogenesis, regardless of which type, is a death sentence. Treatment options available for achondrogenesis is palliative care and/or life support. Palliative care means to reduce or minimize pain and stress as much as possible and is most commonly used treatment choice for treating achondrogenesis. Life support is very rarely used when an infant is born alive with achondrogenesis. This is due to the expected zero chance of recovery or survival and the poor quality of life. No one with achondrogenesis has ever made it to adulthood. So, an ethical question that goes along with any topic or discussion of achondrogenesis is, should termination of pregnancy be recommended by doctors if achondrogenesis is discovered in early pregnancy? From my point of view, the best predicted outcome is an infant born with achondrogenesis on life support for less than a month. Due to this very poor quality of life for the infant and taking into account the mother's health and well-being as well, termination of pregnancy should be an option offered and recommended by doctors to minimize the amount of pain and suffering. So this would go along with palliative care. Another social question that goes hand in hand with achondrogenesis is, should genetic counseling be mandatory for couples who wish to conceive for any risk factors prior to pregnancy? So risk factors could include achondrogenesis or any genetic issues. So in a perfect world filled with money and resources available to everyone, the answer is yes, obviously genetic counseling should be mandatory for any couples who wish to have a baby. This, however, due to the expensive cost of genetic counseling, the cost ranges from $250 to $4,000 or more, and available resources, time, etc., genetic counseling cannot and should not be mandatory for couples wishing to conceive, but should be strongly recommended for any couple who has the means and resources. So a medical question is, should any treatment be administered such as life support, or should all treatment be palliative? Since I'm not a doctor, I turn to research and actual medical doctors, and according to the National Organization for Rare Disorders, aka NORD, palliative care is the best answer. Physicians attempting to reduce or minimize pain, stress, and specific symptoms associated with the disorder. Genetic counseling is recommended for families with affected child. Psychosocial support for the entire family is essential as well. Unfortunately, due to the zero survival rate of achondrogenesis, the best course of action is palliative care due to the poor quality of life and short life of an infant with achondrogenesis. So if you'd like to go back before, I cited all my sources with quotation marks and numbered them. And then here's a number of all of my sources in APA format. Thanks for listening to my TED Talk, and I hope you learned a lot about achondrogenesis.